All right. Hello. Good afternoon. See. Hi, Megan Claire. Welcome. Happy Tuesday. So today we will be talking about depression and understanding that depression is more than feeling sad. So thank you for being here today. I'm going to talk about what causes depression, the different types, common signs and symptoms, and most importantly, some takeaways of what we can do or what you can do to help yourself. One of the biggest misconceptions about depression is that it's simply feeling sad. Even though sadness can be a part of depression, it's so much more than that because it affects our emotions, our thoughts, our bodies, our relationships, our motivation, and even how we experience physical pain. So last week, our chat and chew was about chronic pain and how that connects to depression and the nervous system. And one of my main takeaway from that chat and chew was to think of depression as a survival response instead of maybe a character flaw. It affects people deeply to, on a cellular level. So hopefully by the end of today's chat and chew, my hope is that you'll better understand depression, recognize some of its warning signs, and walk away knowing that depression is highly treatable and that recovery is possible. So as we begin, I want you to think about this question. When you hear the word depression, what words or images immediately come to mind? So just take a few seconds to reflect on that. Um, and maybe you can put your response in the chat. So while you're doing that, if you want to participate, I'll just go into what depression is. So it's a mood disorder characterized by persistent feelings of sadness, emptiness, hopelessness, and a loss of motivation or interest in activities that you once really enjoyed. Notice the word persistent. Everyone experiences sadness from time to time. We all have bad days after disappointing news, conflict, or loss. That's part of being human. But depression is different because it doesn't just come and go. It often lingers for weeks, months, or even years if left untreated, and it begins to interfere with everyday life. It can make getting out of bed feel overwhelming. It can make simple tasks like showering, meal prepping, or preparing meals, answering text messages, phone calls feel exhausting. It affects how we think, how we feel, how we make decisions, and even how like I said, how our brain processes physical pain. Many people living with depression describe feeling emotionally numb rather than sad. Others feel overwhelmed with guilt, hopelessness, irritability. It looks different for different people. So when I say a disorder, what I mean is a disorder is a disruption or abnormality in how something normally functions. So when we think about depression as a disorder, rather than like a choice or a weakness, and even a survival response, it changes the conversation. Depression is not laziness, it's not a character flaw, it's not a lack of will power. It's a medical and psychological condition that affects the brain functioning, emotions, behavior, and physical health. Just as someone with diabetes cannot simply will their blood sugar into balance, someone with depression cannot simply decide to feel better. Understanding this helps to reduce stigma and encourage people to seek help. So, what causes depression? That's what a lot of people ask. The answer is that there usually isn't just one cause. Depression develops from a combination of biological, psychological, environmental, and social factors. So, a few things to kind of get into is genetics. If depression runs in your family, you risk a higher chance of developing depression yourself. However, having a family history of it does not guarantee that someone will develop depression. Life experiences like trauma, abuse, grief, divorce, financial hardship, relationship problems, and chronic stress can all increase someone's risk for depression. Sometimes depression develops after a major life event, like a diagnosis of cancer. Other times it develops after years of carrying chronic stress. Medical conditions like cancer can contribute to depression, um, and other medical conditions like diabetes, Parkinson's, and chronic pain conditions, um, thyroid disorders, and neurological illnesses. All of those things can also contribute to depression. Living with ongoing health challenges can affect the body and the brain. Depression is also associated with changes in neurotransmitters such as serotonin, which is a chemical that helps regulate mood, and dopamine and norepinephrine. They also play a big role in motivation, energy, sleep, and concentration. With these symptoms being disrupted, symptoms of depression start to develop. It's important to remember that depression is rarely caused by just one thing. It's often the result of several factors interacting together. So there are different kinds of depression. It's not a fits all. Um, so the first one is situational depression, which is also known as adjustment disorder with depressive mood. And this type develops after a stressful life event, like losing a job, going through divorce or a breakup, receiving a serious medical diagnosis, moving to a new place, or losing someone you love. Symptoms usually begin within 3 months of the stressful event and often improve once the stressor has resolved or the person adapts to the situation. And we'll say the criteria in the DSM would say like the stressor has to be gone. And after 6 months, then you would say like the adjustment disorder with depressed mood is resolved. Next is seasonal affective disorder. This is when some people notice their depression returns every year during the late fall or winter season. It's also known as SAD or SAD. Reduced sunlight affects serotonin production and vitamin D levels in our body, and it impacts our body's internal clock, known as our circadian rhythm, which deeply impacts our mood. And usually the treatment for this is how it resolves is when the seasons change and it becomes spring, summer. A lot of people feel better because there's more sunlight. But in the winter, a lot of people use light therapy. Um, it's a special light box or like a lamp. It's called I can't remember the name, but um, it helps mimic the sunlight. So a lot of people get that in the winter, and also things like physical exercise, spending time outdoors when possible, and talk therapy as well are other ways that people deal with seasonal affective disorder. Next is postpartum depression. So this kind of depression happens either during pregnancy and after childbirth, which brings tremendous physical, hormonal, and emotional and lifestyle changes. Um, in postpartum depression, some mothers experience intense depression. Um, well, they'll in postpartum depression, they'll experience intense depression after giving birth, but they can also start to experience depression while they're still pregnant. And it's far more serious than what's known as the baby blues. And these symptoms include sadness, anxiety, exhaustion, and difficulty bonding with the baby, which often brings a sense of guilt and feeling overwhelmed. But with appropriate support and treatment, this is recovery is possible. Next type of depression is major depressive disorder. So this is the type most people think about when they hear the word depression. People experience a persistent depressed mood or loss of interest in activities, along with other symptoms that interfere with work, school, relationship, and daily functioning. Um, and then this persistent depressive disorder. So this used to be called dysthymia, which involves a chronic low mood lasting 2 years, at least 2 years in adults. I think a year for kids and adolescents. And the symptoms may be less severe than major depression, but because it lasts so long, it can significantly affect the quality of someone's daily life. And by the way, with major depressive disorder, usually to fit the criteria, you have to meet certain symptoms for at least 2 weeks straight. So, biggest difference between major depressive disorder and persistent depressive disorder is the time. So, persistent is chronic and it lasts for years, even though sometimes it's not as intense as major depressive, but it's there for a long time. So, recognizing the signs and symptoms, depression, it affects more than emotions. It affects nearly every area of a person's life. Common symptoms include persistent sadness, hopelessness, or emptiness, loss of interest in hobbies or activities that were once enjoyable, low energy or overwhelming fatigue, difficulty sleeping or sleeping more than usual, changes in appetite that result in weight loss or weight gain, difficulty concentrating, remembering information or making decisions, feeling guilt, worthlessness, or excessive shame or blame, moving or speaking so slowly, or the opposite, feeling restless and not being able to like sit still, increase anxiety or irritability. And in severe cases, thoughts of death, suicide, or self-harm. And if you ever have thoughts of hurting yourself, or other people, call 911. The National Suicide Hotline number is 988. Um, and for someone to receive a diagnosis of major depressive disorder, symptoms, like I said, typically need to be present nearly every day for at least 2 weeks and significantly interfere with daily functioning. If someone is experiencing thoughts or feelings that are immediate and dangerous, you have to seek help by contacting emergency services or the crisis hotline. So next, we'll talk about treatment. Depression is one of the most common mental health disorders, and it is also one of the most treatable. Many people recover with the right combination of treatment and support. Treatment may include psychotherapy, where individuals learn healthier coping skills, process difficult experiences, um, and also have assessments like depression assessments. The most widely used and popular one is the PHQ-9, which is like 9 questions. And you rate the symptoms on a scale of like 0 to 3, where 0 is you never experience it, 1 is a little bit, 2 is like more than half the time, and 3 is every day. Those scales are really beneficial, not only to the therapist that is like conducting it with you, but also for the client, because it helps you track how your depression symptoms are changing over time. Next is medication, such as antidepressants, um, which is also can be very helpful for people, especially if they have moderate to severe depression symptoms. And I always like to kind of explain medication as it's like a support. So I always use this analogy of a ruler. So you have a ruler that is 12 inches long, and the 0, the bottom, represents rock bottom. In depression, this might look like you can't get out of bed, you're not taking care of yourself, not taking a shower, maybe not eating. And so when you're that low, going to therapy is not as helpful because you're not even meeting your basic needs. Sometimes, oh, let me just back up. So that's 0. That's what 0 represents. 12 represents peace. It represents being able to experience joy. It represents being able to maneuver like the highs and lows of life, because the truth is, stress happens. Bad things happen sometimes, and it's just about being able to manage them. And so some people think that medication is supposed to like take away all negative feelings, it's supposed to make you happy. But instead, what it does is antidepressants might give you a bump of 2 or 3 inches. That might be what you need chemically in your body to get out of bed, to start eating, to re-engage with people or things that you like to do, to go to therapy. And then the rest of the, let's see, 9 inches or so is all you. That's all of the work that you do to take care of yourself. Maybe that includes, like I said, engaging in relationships again, or doing hobbies, things that you really love. It's therapy, it's using coping skills. And those 9 inches all help you get to hopefully achieve that 12 at the top. So research consistently shows that many people benefit most by a combination of therapy and medication. For some people whose depression does not improve, I think it's called treatment-resistant depression. There are other treatments options that include brain stimulation therapies such as electroconvulsive therapy or ECT, and other evidence-based interventions recommended by medical providers. Treatment is not a one-size-fits-all. Recovery often involves finding an approach that works best for the individual. And so Few takeaways before we finish that I'd like to leave you with are practical ways to support yourself or someone you care about. So first, seek support. Depression often tells people to isolate, but healing happens through connection. Talk to a trusted friend, family, reach out to family, join a support group, or connect with a therapist. Most people who have depression are not talking to people. They are not seeking therapy. They're just kind of carrying it alone, which is sad because it's such a common experience most humans have, and they're not alone. And again, it is one of the most treatable conditions to have. So you don't have to carry depression alone. It's really important to seek support. Second, prioritize self-care. Self-care doesn't have to be about luxury. It's about giving your brain and body what it needs to function. So some examples are regular movement, um, yoga, tai chi, exercise, dancing, walking a dog, um, anything where you're able to move your body. And part of this is, emotions are often stored in our body, in our muscles. And so if you imagine like being tense all the time, which is like that anxiety, that fear, those emotions that just kind of get trapped in the muscles, and without movement, they're just there. And it tightens your fascia and everything and can cause discomfort too. And being able to move and release that, let it out of your system, let it out of your muscles is very, very, very therapeutic and good for you. Nutritious food, that is a big, that's important. There's more and more research and talk about gut health and how eating fermented foods are really good to help the microbiome in your GI system. And actually, serotonin, which is a chemical in our brain that helps us regulate our emotions, 90% of it is created in our gut. And so eating nutritious foods to help kind of create that serotonin to travel to the brain is really important in self-care and kind of fighting against depression. Sleep, 7 to 9 hours of sleep. I know there are people who can, they're good on 4 or 5 hours of sleep. That's good for you. That's good. But sleep is very important. And mindfulness practices like yoga, like meditation, breathing exercises, and again, in Tai Chi, those are also very helpful for self-care. Limiting alcohol and recreational drugs because they can worsen depressive symptoms. And just taking small, consistent habits often make a meaningful difference over time, and um, feeling like you are, oh, word finding is hard sometimes. Not progressive, but you're taking steps, you're accomplishing it. It helps with that sense of accomplishment. That is also really helpful. Um, when you're depressed, oftentimes you don't have motivation to accomplish anything. So, and then the third thing that helps is learning your warning signs. Everyone has different triggers, and it's up to you to notice the changes in your mood, your energy, your sleep, your appetite, and your motivation. Um, You could even like use a journal once you recognize something's off, just to keep track of those things, um, to help you identify patterns and track your mood. And the sooner you recognize the changes, the sooner you can seek support before the symptoms become more severe. So, in closing, I like to end with one important message. Depression is not a personal failure. It is not a weakness. It is real. It is common. You're not alone, and it is treatable. Whether you are personally experiencing depression, supporting a loved one, or simply learning more about it today, knowledge helps to reduce stigma and encourage compassion. If there's one thing I hope you remember, it's this. Recovery is possible, help is available, and no one has to face depression alone. So thank you for listening and taking the time to learn more about depression. Um, and I'd be happy to answer any questions anyone might have. I'm gonna look into the chat. Let's see. All right, Dr. Wendy says, how should we talk to our doctors about depression? Hmm, that's a good question. A lot of doctors' offices screen for depression, but I think it depends on what you're going there for. So, like, for example, if you're pregnant, I know they will have you do the PHQ-9 every time you go. Sometimes for like a annual physical, they'll have you do a depression screener. And that's a great way to kind of start that conversation. The doctor kind of looks at well, not the doctor, it's usually the nurse who you're with first who administers it. And then they look at the score, and then that's a great way to start the conversation. Or even just, just saying to your doctor, hey, I've been having this low mood. Um, you know, maybe I want to talk about what are the possibilities, whether it's a referral for therapy or starting off a medication. Um, just being open and honest. And, a lot of that has a, a big, you have to be comfortable with your doctor. That's a big part of it too. Having a good relationship with your primary care doctor where you can feel open enough to say that you're struggling. It's very brave. It takes a lot of courage to let somebody know that you need help. So that's a great question. And does depression and anxiety go hand in hand? I love that question. Um, Sometimes it does, and other times it doesn't. So depression, I always think of that saying like, which came first, the chicken or the egg? Sometimes people have such bad anxiety symptoms that it leads them to having depression. So an example is like if you have really bad social anxiety, it might impact you from making connections with people, going to social outings, which increase symptoms of isolation, or it might make you not have the motivation to do things that require being around a lot other people, or just that fear might keep you from having the motivation to do things that would probably be good for you. And then on the flip side, having those depressive symptoms where you might have really bad self-esteem or feeling very low can make you anxious about having to be around people. So depression can like lead to this anxiety based on the symptoms. Um, but they often they often are kind of co-occurring, they're co-occurring conditions, but not always. All right. How should we talk to our family about depression since they can experience depression when a loved one has cancer? That is a great question. So, and it's a delicate question because we have to consider lots of different things. We have to consider culture. Culture plays a big role in how people kind of think of depression. Some cultures are a lot more open in talking about it, others are not. Um, we have to think about generational differences where generations now, younger people are a lot more accepting and open about talking about depression and even seeing it as more of a biological condition rather than like a personal choice, which might be the way older generations look at depression. Um, Overall, again, just kind of like that example with the doctor, knowing and finding your people who can give you support in simple ways, just like having a conversation and being able to explain, like, this is how I'm feeling, this is what I'm going through, because despite any culture or generational difference, most human beings have experienced some type of depression in their life. And I think what makes it hard would be just the stigma. So, in talking to families about depression, especially if their loved one has cancer, is just being open and honest and maybe even talking about what some of the symptoms are that we went over today. And yeah. All right. Thank you. Bye.